Medical College Kolkata, previously known as Medical College Bengal, was established in 1835. Since then till 1910, the surgical wards were housed inside the iconic MCH building. In 1910-11, the Prince of Wales Hospital was commissioned to commemorate the visit of the then Prince of Wales, King George V. This became the center of excellence of surgery in the state, with luminaries like Dr. L.M. Banerjee, Dr. Panchanan Chatterjee, Dr. Subodh Datta leading the way. In 1976, Prince of Wales Hospital was renamed as David Hare Block after the only non-medical principal of Medical College Kolkata. Currently, DHB Down on the first floor has 4 male cabins which have recently been made air conditioned. Apart from this, there is 1 female ward in the east wing, 1 male ward in the east wing and 1 male ward in the west wing. There is the unit room of Unit 4 surgery in the west wing. Some wings and extensions are being used by Department of Radiodiagnosis and Radiotherapy. 1 ward will be reclaimed from Department of Radiodiagnosis very soon. In THB Up, one comes across the morning room, which was recently revamped as the office of Head of the Department of Surgery after the latter was relocated from Green Building. The west wing has 2 female wards and unit room of Unit 2 surgery. In the central part, we have 2 turrets used as cabins for female patients which have been recently made air conditioned. 2 more turrets are being used as office of Department of Surgery and departmental ultrasound room where surgeons themselves perform ultrasonography. The east wing houses the 8-bedded HDU, exam or seminar hall and unit rooms of units 1, 3, 5 and 6. The morning room or the room of the head of the department has 1 board displaying the names of all the past head of the departments and 2 boards respectively displaying the names of all best resident awardees and MS toppers over the years. This is one of the female cabins that we have already spoken about. Let us give you a tour of the DHB Up East Wing, which houses the 8-bedded HDU or high dependency unit where critical patients are managed after operation. This is the HDU. This is the exam hall or the seminar room where ward ending examination is under process. The walls of the seminar room can be seen to be adorned with pictures of interesting cases. Let us give you a tour of one of the unit rooms, the unit room of Unit 5. Now you can see the DHB Up West female wards. The northern section of DHB Up is home to the DHB OT complex, which has trained generations of surgeons. In its original form, the majestic DHB OT complex had OTs with galleries, justifying the term Operation Theatre. Between 2007 and 10, it was renovated and the old gallery structures were taken down, giving it the current form. Currently, there are 3 OTs in the DHB OT complex. The OT complex was recently renovated and was reopened last month. Let us give you a tour of the new OT complex, the faculty room, the doctor's room for the anesthetists, the 3 OT rooms in which operations are done, and the recovery room for patients. The third floor of the DHB building currently houses the cardiothoracic and vascular surgery wards and OT. The ground floor houses the office of MSBP along with other offices. The current emergency building was actually called the Centenary Building and was inaugurated in 1935 by the then Governor John Anderson. Emergency patients of surgery, including burns and head injury patients, get admitted in CB Top, which is in the 2nd floor of the emergency building. It comprises of CB Top male and female wards and an OT complex. The general surgery wing of CB-Top OT complex has one operating room with 2 OT tables, its own autoclave room and duty rooms for residents. The female ward has a separate air-conditioned burn section. The male ward has separate air-conditioned head injury and burn sections. CB-Top female ward was recently expanded with the addition of around 30 beds inside an air-conditioned ward. This is the OT complex with duty rooms of residents, the OT proper and autoclave rooms. This is the female ward at CB-Top. This is the burn section of the female ward. Giving you a tour of the male ward at CB-Top. This is the male burn ward. This is the male head injury ward at CB-Top. Giving you a tour of the recently inaugurated air-conditioned extension of the CB-Top female ward. Currently, Department of Surgery has 5 professors, 4 associate professors, 9 assistant professors and around 15 senior residents. We have 250 MBBS and 12 MS General Surgery seats per year. Our department performs all basic and advanced general surgical procedures, including advanced laparoscopy and oncology. Several of our path-breaking works have found mention in the digital, print and electronic media over the years. In the last few years, several of our faculties and residents have presented papers in state, national and international conferences, including those at San Antonio Breast Cancer Conference at Boston, Asian Association of Endocrine Surgery Conference at Japan, Tokyo, and several others at Barcelona, New York, and alike. Several of them have won Best Paper awards as well. Several of our faculty members have come up with publications in prestigious national and international journals and book chapters in several books by publishers of international fame. In the future, we dream to start several highly specialized subspecialty units and clinics, including robotic surgery units and a varicose vein clinic with radiofrequency ablation and endovenous laser ablation. We want to offer all available state-of-the-art facilities to the patients in future. The surgery OPD is located in the first floor of the new OPD building at gate number 3 and operates from room numbers 209, 210, 213 and 214. We have special clinics namely Pancreas Clinic and Breast and Endocrine Surgery Clinic, operating from room number 212 on Wednesday and Saturday respectively. Room number 215 serves as minor or daycare OT, and room number 201 is used as dressing room.